Hello, and welcome to our overview of caring for transgender cancer patients. First up is a little glossary with some phrases that you may encounter as you care for transgender non-binary patients. Feel free to come back and reference that whenever you need to. So, what does it mean to be transgender? Well, we are all born, and at birth, based on our genitalia, we're assigned a sex. And then as we grow up and are in society, we develop a gender identity, usually, but not always, based on our sex. With transgender individuals, those two things do not overlap. And the distance between them causes some distress, and that can present as gender dysphoria for them. So let's go over some terminology. The ones on the left are good, the ones on the right are not good. So transgender individuals are women, they are men. They may describe themselves as trans or transgender, gender queer, gender nonconforming, or non-binary. The terminology on the right is derogatory and inappropriate and should never be used. Feel free to use the words that the patient uses to describe themselves as you then give report and discuss the patient about to other people. If the patient happens to use one of the derogatory terms to describe themselves, it is not okay for you to use that term to describe them to other people. So let's talk a little bit about transitioning. There are three different types of transition, social, physical, and legal. Social transitioning is what most people see out in the world. That's when an individual, either full-time or part-time, goes out into society as their chosen gender. This can entail changing their clothing and their hairstyle. It can include packing, tucking, binding, and sometimes prosthesis to help them be more comfortable and confident in their presentation. They'll also, part of social transitioning is coming out to friends and loved ones. Physical transitioning can involve hormone therapy, hair removal, speech therapy to address or control the tenor of their voice, some fertility preservation, and then whatever surgical options are open for them. Legal transitioning involves the individual having all of their legal documents changed to reflect their chosen name, their gender identity, and pronouns. So let's talk a little bit about social determinants of health with transgender people. First thing to understand, many transgender individuals do not have support from their immediate family. So 34% of adults and 47% of transgender teens either have neutral or unsupported families. And that's important to remember as they go out into the world to live their lives. Over the course of their lifetime, 30% of trans people will experience homelessness, where only 14% of the general US population will do so in their lifetime. Unemployment in 2022 was 18% for trans individuals. The general population, it was 3.5%. The poverty rates are extraordinarily high. 34% of trans individuals live in poverty, where 11.5% of the general US population lives in poverty. And then finally, domestic violence. 11% of trans people experienced domestic violence in the past year, where only 6% of the US population experienced the same thing. So let's talk about transgender people interacting with the healthcare system. As you saw from the previous slide, they don't have a lot of support. So 28% of transgender people in the past year did not see a provider when they needed one because they couldn't afford it. 24% did not see a healthcare provider when they needed it because they were scared that they would get mistreated. Of the people that went to see a healthcare provider, 48%, nearly half of them, had at least one negative experience that related to their gender identity. They were either refused health care, they were physically or verbally abused, treated roughly, um, or were misgendered. So I want to talk a little bit about broken arm syndrome. So broken arm syndrome, it's also known as trans broken arm syndrome. It's a form of medical discrimination um, where a provider incorrectly assumes that a medical condition results from a patient's gender identity or medical transition. It can either be the incorrect and explicit misattribution of gender identity and transition as the cause of an acute complaint, or it could be just invasive and unnecessary questions regarding gender and transition um, in the process of an acute condition. So if you come in because you have a broken arm, nobody should ask about your prostate or lack thereof. Mental health is a big concern for the trans community at large. Um, so in 2022, 39% of transgender individuals experienced severe psychological distress. The rest of the population at large experienced that at a rate of 5%. Over their lifetime, 40% of trans individuals will attempt suicide. Just last year, 7% of trans individuals attempted suicide. The general population of the United States, over their lifetime, 4.6% will attempt suicide. And last year, 0.6% of the general population attempted suicide. When we're talking about sexual assault, it's just as bad. 47% of transgender individuals will be sexually assaulted during their lifetime. 17% of the total US population will be sexually assaulted over the course of their lifetime. But just in the past year, 10% of trans people experience sexual assault, while only 0.16% of the overall population experienced sexual assault. So let's talk a little bit about dead names. What's a dead name? So a dead name is the name that an individual was assigned at birth that they have chosen to no longer continue using during and after their transition. Dead naming can also be a verb. When you call a person by their incorrect name, it's called dead naming them. If a patient has not completely legally transitioned yet, their new or chosen name may appear in the medical record as it is surrounded by quotes or parentheses. Verify that this is the name they want to be called. So, what barriers are there to transgender individuals accessing healthcare? Okay. If you said all of the above, you're on the right track. Good job. All right. How can we not be part of the problem? You're going to have to start getting used to using more gender neutral honorifics such as y'all and folks. Avoid using ma'am and sir. There's a great resource from the Office of Mental Health in New York State right there that'll give you a good overview of that. If the patient's dead name is still part of the medical record, make sure they know what the process is for their safety. Make sure they know that they're going to have to say that to you to ensure that the medications they're getting are the ones that are meant for them so that it's not a surprise. Never assume the relationship of visitors. Ask who the visitor is and if you can speak about medical matters in front of them. Same thing for the patient. Don't make assumptions. Ask them who they are and how they want to be addressed. Then do it. Read the chart and verify with the patient that their name and their pronouns are documented correctly. If you make a mistake, apologize and move along. Don't keep apologizing. Before determining how your physical assessment is going to go and what questions you're going to ask yourself, is their gender or sex pertinent to the care that you're about to provide? If they're coming to you to have their central line accessed, it does not matter if they've had surgery. Check in with your patients about their support systems often. You may need to do depression and distress screenings more often than the recommended annual screenings. Offer comprehensive cancer support program services early and often. This includes psychiatric care, nutrition services, social work, and transportation assistance. So let's talk about some practical implications. When you're introducing yourself or trying to get introduced to your patient, what is your name? If they don't give you all the names that are in your computer, ask them follow-up questions. Is there a different name on your insurance? Does your insurance think you have a different name? Is there another name that might have been used previously? Is there another name in our records? Avoid using the word your when asking about a name that they did not volunteer. This assigns that dead name back to them when they've chosen not to use it. So a little bit about pronouns, ask what pronouns do you use or what are your pronouns? Start by volunteering your own. It's nice to meet you. I'm Megan, she, her. How do I address you? Avoid using the word preferred when referring to pronouns. It's not their preference or their choice, it's just their pronouns. So, practical implications for medication administration. You're with your patient, it's time to give them their meds. You're going to go check their armband. Please tell me your name and birth date, and don't forget to include the other name for me. Just a little reminder, because if you've done your education ahead of time, this won't be a surprise for them. Okay, please tell me your name and birth date. If they don't include all the names that you need, then you're going to need to ask a follow-up question. What's the other name that my computer thinks you have? What's the other name your insurance company thinks is yours? And what is the other name? This last one is the one that the Oncology Nursing Society recommends. It is pretty generic and versatile and can be used in a variety of situations. Don't ask what is your other name. It's not their name anymore. Okay, so what are two things to consider for your transgender patients? Okay. They may need screenings for depression and distress more often than other patients, and you should educate them up front about the need to verify all the names that are on record for their safety, even the one that they don't like anymore. And then here are your references. These are great overview references for general knowledge and how to interact with the transgender community. Thank you.